I'm Dr. David Wikenheiser. I'm a naturopathic physician and I work with people to solve their health concerns using regenerative medicine. This video is the fifth in my series on low dose immunotherapy, also known as LDI. This is an important treatment for balancing your immune system. In this video, I will discuss the history of low dose immunotherapy. So it started with Dr. Leonard McEwen, who's an MD in England. Dr. McEwen had studied under Dr. Popper, a medical doctor out of Czechoslovakia, and Dr. Popper had used an enzyme known as beta glucuronidase. So in the 1960s, Dr. McEwen developed a process known as enzyme potentiated desensitization. The enzyme being beta glucuronidase. So in a treatment with a patient, based upon Dr. McEwen's experience, he injected this enzyme into the polyps in the nasal passages of a patient. The goal was to shrink down the polyps and allow them better inhaling, better nasal function. And they did. The nasal polyps shrunk down, but there was a side effect that Dr. McEwen had not anticipated. This patient who had been treated for nasal polyps also had a reduction in their allergies. So Dr. McEwen figured that this was an interesting happenstance discovery, that exposure to a person's allergens along with the enzyme known as beta glucuronidase would really be useful for rebalancing the immune system. So an overactive immune system could be calmed down. He called it enzyme potentiated desensitization. This information had been shared widely. There was a doctor in the United States by the name of Dr. William Schrader. He, as he explains in his lectures, because he teaches this therapy, teaches low-dose antigen therapy, as Dr. Schrader relates, that he had personal health conditions that were limiting his health, and through the use of enzyme potentiated desensitization, he was able to overcome his health challenges and help as well many of his patients to do the same. And it was going great. Dr. Schrader's in the United States, other doctors around the world were using the various injectable preparations. The enzyme potentiated desensitization involved injections of allergic triggers, antigens, with the enzyme beta glucuronidase just under typically the skin of the forearm. And it would get red and there would be some reactions, but people would form up new thymus T regulator cells and calm down their immune system. So this was going great. They're doing really well until in the United States, the Food and Drug Administration, the arm of the federal government that regulates medicine and drugs, it was their decision that enzyme potentiated desensitization products that had been imported into the United States and used by many doctors, including Dr. Schrader, that they were not meeting the guidelines and the stipulations of the FDA. So they banned the importation. So that presented some pretty big problems. Doctors that were treating their patients were not able to. The American Academy of Environmental Medicine, of which Dr. Schrader is part, and he's, I think, founding president, this group of doctors who were using enzyme potentiated desensitization. And it was available, again, up until the time that the FDA stopped it, and that was in 2001. So the ban on importation went ahead. Doctors aren't able to treat their patients and continue to get the great results that they had been. So to solve that, Dr. Schrader enlisted the help of a sequence of different compounding pharmacies. So by being a compounding pharmacy, you could still comply with Food and Drug Administration's guidelines, but go under a different category, and the doctors who were using enzyme potentiated desensitization, they were able to continue their treatments. So Dr. Schrader spearheaded this, and he then changed the name from enzyme potentiated desensitization, EPD, to Low Dose Antigen Therapy, LDA. So LDA, it's available from pharmacies in both the United States and Canada, compounding pharmacies. And that's well and good. There have been some more innovations in the immunotherapy area. So Dr. Ty Vincent, United States medical doctor, originally practicing in Alaska, then Alaska and Hawaii, and now exclusively in Hawaii, moved his family there. He was using low-dose antigen therapy, LDA, to treat patients since 2005. Now he also presents lectures on low-dose antigen therapy with the American, or for the American Association of Environmental Medicine. So that professional group that Dr. Schrader is part of and lectures for, and they also lecture on and tell doctors and teach doctors about low-dose immunotherapy, which is a little bit different from low-dose antigen therapy, and I'll cover that in the next video on comparing the two. So the history is, first it was Dr. McEwen, then it went to Dr. Schrader, then on to Dr. Vincent. Now, my history is as a medical student, naturopathic school, I was introduced to the practice of Dr. Craig Wagstaff, naturopathic physician who practiced in Kelowna, British Columbia, Canada. And I was a preceptor in his office all of July 1994. He was using extensively oral, meaning under the tongue, drop desensitization treatments. And he did that throughout the 1990s. I precepted his office, took courses from him after I graduated. So when I was out as a doctor in the, it would have been probably around anywhere from, I was taking courses 97 through about 2000. And some other courses later on. So I learned what process they were using to do the serial dilutions and some of the theory behind what was going on in their office. They're getting great results and helping a lot of people treat their allergies by getting their bodies to stop overreacting. So that was in the 1990s when Dr. Wagstaff was, and long before that too, in the late 70s, throughout the 1980s, 1990s, a very large following of patients for Dr. Wagstaff. I was shocked how far they would come. And in fact, quite a few naturopathic doctors that I know and have met over the years got into that form of medicine and went to school because they had been treated by Dr. Wagstaff. So I've been in his office a number of times and learned what the staff are doing, what his philosophy was. Quite interesting. So I was treating a patient in Kelowna here in about 2004, 2005. They had a case of vitiligo. That's where in the summertime they have pink skin and not brown skin with the sun exposure. In other words, their melanin cells were not producing pigment. Now there's a whole progression there where immune reaction against gluten in the gut would create antibodies that would then attack the thyroid, anti-thyroid antibodies, same antigens, or antibodies, pardon me. And then the third progression is tyrosine, the amino acid that helps the thyroid make the hormone thyroxine that regulates how you use oxygen to capture energy from your food. That also made the melanin. So we treated that with low-dose immunotherapy. It worked quite well. So now we're going to go on to video number 6, LDA versus LDI.